Here are 11 symptoms of vitamin B12 deficiency you should not ignore. It is important to know that the human body does not create vitamin B12, so people must get this nutrient from their diet. So do you know how much vitamin B12 you consume every day? Do you know if you are getting enough? Vitamin B12 is an essential nutrient that our bodies need to be healthy. It's responsible for making red blood cell, nerves, and DNA, and it helps support the nervous system. The thing is, we can't produce B12 on our own. Like most other vitamins, we need to consume it. On average, an healthy adult must ingest at least 2.4 micrograms of B12 each day. However, some people don't consume enough B12-rich food or supplements. And others are unable to absorb enough B12, no matter how much they take in. The result is that many people develop B12 deficiencies, and you might be one of them. Plus, as you grow older, you will become progressively susceptible to vitamin deficiencies. Many of the symptoms of vitamin B12 deficiency arise because it causes a lack of healthy blood cells. The body needs plenty of these cells to get oxygen around the body and keep the organs in good health. So be sure not to ignore the following signs.
Weakness and fatigue. If you're low or deficient in B12, you'll likely feel fatigued. Your body's cells need B12 to function properly. As such, having inadequate B12 levels can decrease normal red blood cell production, which can impair oxygen delivery. Specifically, a deficiency in B12 or folate can cause megaloblastic anemia. This condition leads to the formation of large, abnormal, and immature red blood cells and impaired DNA synthesis. When your body doesn't have enough healthy red blood cells to carry oxygen to tissues, you'll likely feel weak and tired. It's important to know that you can develop fatigue and other symptoms related to B12 deficiency, even when your B12 levels are considered within range or only borderline low. Tingling hands or feet. Vitamin B12 deficiency may cause pins and needles in the hands or feet. This symptom occurs because the vitamin plays a crucial role in the nervous system, and its absence can cause people to develop nerve conduction problems or nerve damage. In the nervous system, vitamin B12 helps produce a substance called myelin. Myelin is a protective coating that shields the nerves and helps them transmit sensations. People who are vitamin B12 deficient may not produce enough myelin to coat their nerves. Without this coating, nerves can become damaged. Problems are more common in the nerves in the hands and feet, which are called peripheral nerves. Peripheral nerve damage may lead to tingling in these parts of the body. Trouble walking. Over time, peripheral nerve damage resulting from vitamin B12 deficiency can lead to movement problems. Numbness in the feet and limbs may make it hard for a person to walk without support. They may also experience muscle weakness and diminished reflexes. Pale skin. Pale or yellow skin, called jaundice, may be a symptom of vitamin B12 deficiency. Jaundice develops when a person's body is not able to produce enough red blood cells. Red blood cells circulating under the skin provide it with its normal color. Without enough of these cells, the skin may look pale. Vitamin B12 plays a role in the production of red blood cells. A vitamin B12 deficiency can cause a lack of red blood cells, or megaloblastic anemia, which has an association with jaundice. This type of anemia can also weaken the red blood cells, which the body then breaks down more quickly. When the liver breaks down red blood cells, it releases bilirubin. Bilirubin is a brownish substance that gives the skin the yellowish tone that is characteristic of jaundice. Fast heart rate. A fast heart rate may be a symptom of vitamin B12 deficiency. The heart may start to beat faster to make up for the reduced number of red blood cells in the body. Anemia puts pressure on the heart to push a higher volume of blood around the body and to do it more quickly. This response is the body's way of trying to ensure that enough oxygen circulates through all of the body's systems and reaches all the organs. Shortness of breath. Anemia that results from vitamin B12 deficiency may cause a person to feel a little short of breath. It is possible to link this to a lack of red blood cells and a fast heartbeat. Anyone who is experiencing real difficulty breathing should see a doctor straight away. Mouth pain. Vitamin B12 affects oral health. As a result, being deficient in vitamin B12 may cause the following mouth problems. Glossitis, which causes a swollen, smooth, red tongue. Mouth ulcers. A burning sensation in the mouth. These symptoms occur because vitamin B12 deficiency causes a reduction in red blood cell production, which results in less oxygen reaching the tongue. Problems thinking or reasoning. Vitamin B12 deficiency may cause problems with thinking, which doctors refer to as cognitive impairment. These issues include difficulty thinking or reasoning and memory loss. The reduced amount of oxygen reaching the brain might be to blame for the thinking and reasoning problems. Decreased appetite and weight loss. As a result of digestive problems, such as nausea, people with vitamin B12 deficiency may lose their appetite. A decreased appetite can lead to weight loss in the long term. Nausea, vomiting, and diarrhea. Vitamin B12 deficiency can affect the digestive tract. A lack of red blood cells means that not enough oxygen reaches the gut. Insufficient oxygen here may lead to a person both feeling and being sick. It may also cause diarrhea.